Now we will welcome Dr. Nicholas Bodenheimer of Novant Health OBGYN. Well, welcome to the show today, Dr. Bodenheimer.
Thank you.
It's a pleasure to have you here. And we'll start off by the way we start most shows, by sharing information about education and background. So tell me a little bit about yourself and your schooling.
Myself, I'm originally from High Point, North Carolina. It's about 3 hours west of here.
Yeah.
I have one brother. He's 4 years younger than me. He's a lawyer in Miami.
Uh-oh.
Yeah. We have a lot of good conversations.
I bet you do.
We do. I went to undergraduate college at Gardner-Webb University in Boiling Springs, North Carolina.
Right.
It's about 45 minutes southwest of Charlotte. From there, I went to graduate school in Omaha, Nebraska at Creighton University and got a Master's of Science in Anatomy. From there, I went to Blacksburg, Virginia, and went to medical school at Virginia College of Osteopathic Medicine. And then most recently, I finished residency at New Hanover Medical Center in Wilmington in obstetrics and gynecology.
Wow. So you've been in this area a while then.
I have.
You're kind of used to the coastal living.
Absolutely. I wanted to stay here too.
I'm sure.
Absolutely.
I'm sure. And we're happy that you chose to do that, especially that you chose Novant Health.
Thank you. I'm happy to be here.
Well, we've had some of your partners at Novant Health OBGYN on the show in the past, and they are a wonderful group. You have a great office. So remind me exactly who your partners are and where your offices are located.
Dr. McCarthy, Dr. Shue, Dr. Toller, Dr. Thompson, and then Sarah Brown's our nurse practitioner. And we have offices right beside the hospital in Bolivia, one at Sunset Beach, and one in Leland.
Now, I understand that you provide a full range of services from babies to menopause and on after. Is that correct?
Absolutely.
Well, no, in all seriousness, tell us a little bit more about the services that you do provide and any special clinical services that you're really interested in.
Absolutely, yeah. As far as the services we provide, obstetrics is a part of what we do, but we also provide a comprehensive range of gynecologic examinations and treatments there too. So anything ranging from abnormal bleeding, menopausal symptoms, breast masses, pelvic organ prolapse, we can treat. And we offer medical as well as surgical management for those. My special interest, it lies in urinary incontinence, pelvic floor surgeries, as well as minimally invasive surgeries like the robotic surgeries.
Since this is October, we're taking a little bit of time in each of our segments today to talk about breast health with each of our guests. So as an OB/GYN, you must field a lot of questions about breast health.
Absolutely, absolutely.
Let's talk about a little bit about that. What kind of questions do you get?
The most common ones is breast pain and then breast lumps. And so when a patient comes in, it's important to kind of characterize what exactly she's experiencing. With the breast pain, is it everywhere, or is it in one particular region? Is it on one side? Is it on both sides? Does it come with the menstrual cycles? Is it cyclic? So all those are very important things to keep in mind when you're discussing breast issues.
I'm curious about self-exam, breast self-exams. It seems to go back and forth. They want you to do it, then they don't, and how often and what time of the month and all that kind of thing. Could you address that a little bit?
Absolutely. So depending on what society you look at, the recommendations differ.
Oh.
So we followed the American College of Obstetricians and Gynecologists, their recommendations. And their recommendations are for mammograms, it's every woman every year starting at 40, okay? For a clinical breast exam, which is what we do, it's women aged 20 to 39 every 1 to 3 years, and then every year for women over 40. They've moved away from the self-exams, and what they're saying now is more self-awareness. And what that means is
what does that mean?
So I'm getting ready. So what that means is you're more in tune to kind of what's natural for you. So whether you have cystic breasts or this abnormal tissue in one breast that you've noticed that's been worked up, you know what's normal for you. What's interesting is that for women over 50, about half of them pick up breast cancer themselves as they're doing their own, self-awareness.
Right.
And for women over 50, it's about 3/4 of women pick it up by themselves. So now it's just more knowing what's normal for your body.
And just, I guess, kind of watching for those changes.
Exactly.
Something out of the ordinary.
Exactly.
That's interesting. So, say I discovered a lump myself. So, what's your recommendation? Do I call you? Do I go to my primary care? Or all the above? Any of those?
You can, it's good to come see us, I think. We specialize in women's health overall. So if you find a lump and you're worried about it, like I said, get an idea, be able to characterize it. Where is it at? When did you first start noticing it? Any pain associated with it? And come see us. And then we'll talk to you, examine you, and then order any further workup that's necessary.
And I know that you are aware that the hospital currently has the Susan G. Komen funds available, as well as the breast health funds. And do you want to talk a little bit about those funds and how those are available to underinsured women?
Absolutely, yeah. So, our big goal is we're here to help, and we're here to serve the community, and we don't want the lack of insurance or anything to get in the way. So with women that need mammograms and screening mammograms and diagnostic mammograms and so forth, they can get in touch with us, and then we have these funds available for them.
Great, that's awesome. Yeah, the most important thing is to get care for those who need it, and getting the word out that those funds are available.
Right.
So I'm sure that your office can help with spreading that word.
Absolutely, we try.
Yeah. Well, this is all great information. Thank you so much for being here.
Absolutely.
We're so happy to have you in Brunswick County. And can you remind our viewers how to get in touch with you and how they might make an appointment?
Absolutely. They can call our main office for new patients and schedule an appointment. If they're already an established patient, you can call the office or go through My Chart and make an appointment with us.
Oh, that My Chart's wonderful, isn't it?
Absolutely.
We love that. Well, thank you again for being here today.
I'm happy to be here.
And we look forward to hearing back from you after you've been here a while.
It was a pleasure.
Thank you.